Hello, hello, hello. Welcome to Dr. Kre and Me. This is a cold day. Well, it's been a really nice day here in town, but it's getting colder. So tomorrow there is a threat of some severe weather. Hey, Shioki. There's some threat of severe weather. So tonight we're going to talk about 7 symptoms or signs that should send you to the ER. So we want to be able, hey Tanya, we want to be able to differentiate between what you should do, what symptoms that should have you to call your doctor and say I need an appointment, and what symptoms you should take into effect and say, hey, I don't need to waste my time calling because I really need to go just straight to the ER. Hey, Marquita, don't forget when you get here to please say hey in the chat, and to also put where you're from, what state you're from. I know Marquita is in from Illinois. So happy belated Founders Day. Hey Cherie. I have a guest tonight in here with me, Zoe. Zoe is not supposed to be talking while we're doing the Facebook Live. Zoe, come tell the people hi. Come tell everybody hi. And then you can go somewhere else. Here comes Zoe. Zoe says hello. Zoe's been home today for Martin Luther King Day. And we just got word that her, hey Nicole, that her school is canceled for tomorrow. So this is all a part of being a working wife and a mommy. Hey Darlene. So tell everybody hi. Tell them you've had a great day today. Say thank you for joining us. And you can follow me at, say it out loud, they can't hear you. Say it in the microphone. Follow me at Dr. Kre. Follow me at Dr. Kre. So that is Miss Zoe Johnson, who's about to be how many years old? They can't understand that. Tell them. Oh, in the microphone. Okay. How many years old?
4. I'm said again.
Okay, one more time. No, just tell them how old you're going to be. 4. Okay. Hey, Miss Doreen is on. Yes, and Miss Cherie.
Hey, Mama. Hey, Mama.
Get down. Okay, I'm going to go get started.
Hey, Mama.
Hey, I'm going to go get started, okay? All right, go.
Put me on the couch.
No, I'm not putting you on the couch. Go sit down. Okay. That's what happens when you're a working wife and a mommy. Go sit down, Zoe. So, welcome to the Dr. Kre and Me show. This is our special guest, Zoe. Okay? You know who I am. I am Dr. Kre. I am a board-certified family medicine physician, and I specialize in what's important to you through my one-on-one coaching, my telemedicine, my concierge practice, and my amazing family medicine practice here in Birmingham. I help you guys learn to live healthier, happier, whole lives. So when you live better and you feel better, you actually can do better. Hey Shannon. So when you get here, please say hello and tell me where you are watching from. I know Shannon is watching from Georgia, and Doreen from in Alabama, and Zoe's gonna go sit down so I can do this. Okay, so today we're gonna talk about, so here lately in Birmingham, in my practice, we've had all kind of crazy things happening. On Thursday, the power went off. The power went off all over the hospital. So I didn't really realize this until I got to work, and it was 3 patients there already. So we improvised and we saw patients until until our batteries died on our laptops. Hey Karen, how you doing?
Hey.
So we saw people until the batteries went out. So there was some kind of fire at the hospital, and the generators, they went to turn the generators on, generators didn't work. So we saw patients on Thursday by natural light. It was warm enough that we were able to go there, see patients, and get everything done. So then on Friday, it got much cooler. So the staff went in to try and call some people back. We still did not have power, but thank God for the little power packs and hot spots. They were able to go in and see some patients. Not see patients, they were able to call patients back and all that kind of stuff. So it was Friday. They were there a couple of hours because it got really cold because there was no heat. So on Friday afternoon, the power came back on. Well, today's Martin Luther King Day. Happy Martin Luther King Day. Hopefully it was a day for you to do some service. We didn't work because we honor Martin Luther King Day and we celebrate Martin Luther King. His amazing wife was from my hometown, Marion, Alabama. So tomorrow in Birmingham, they are predicting a lot of icy conditions, bad roads, so there's a good chance that Brownstown is probably going to be closed tomorrow as well. So as of now, Trustful City schools are closed, which is close to us. Jefferson County is closed, Hoover is closed, and Tuscaloosa are closed. So Brownstown usually goes by if both Jefferson County and Birmingham City both close, then we close. So that's what you need to be watching the news for tonight. Once you hear that they both have closed, then you'll know that we won't be there or whatever. So I'd like to apologize. So that's why I'm doing this segment tonight, to say 7 reasons that you should know to either go to the ER versus going to call your family care doctor or going to the urgent care. Hey Sammy, put where you're viewing from. Hey Miss Carolyn. Okay, so number 1. Hey Montez, how you doing? Oh, they are both closed, so Brownstown will be closed. I know that you know ice storms well since Zoe. Yes, Zoe, you're not supposed to be talking. Yes, I had Zoe. That a lot of y'all know this story, but I did have Zoe in the snowstorm. I got the 2014 snowstorm. I got stranded at the hospital, and my water broke, and I went into labor. And my husband got the luxury of watching delivery on FaceTime. So, without further ado, let's talk about these 7 signs and symptoms that should cause you to go to the ER versus going to call your primary care doctor or going to the urgent care. Hey, Talisha. All right, number 1, the first thing that should call, the first reason that you should go to the ER is chest pain. So chest pain or upper abdominal pain. Remember last week we talked about acid reflux and GERD. We talked about that being an issue, but because this sits right here and so close to your heart, your stomach and your heart are so intertwined, a lot of women have symptoms of their heart attack symptoms are actually similar to acid reflux symptoms. So you're like, oh my goodness, you think you got this acid reflux that won't go away. You've taken your antacid, you're taking your medicines. Thank you, Tanya. You're taking all of that, and then you find that, oh my goodness, it's not getting any better. So chest pain, acid reflux that just won't budge despite your medicines, that's the reason for you to go to the ER, because you could actually be having a heart attack. Hey, Andrea. All right, so number 2 is shortness of breath. So shortness of breath could be a sign of plenty of things. So if you have pneumonia, that can cause you to have some shortness of breath. If you're having a heart attack, you can have some shortness of breath. If you are having heart failure that's out of control, it could cause you to have shortness of breath. Hey Amber, it can cause you to have shortness of breath. And if you have COPD, it's not controlled, shortness of breath. And if you're having a pulmonary embolism, that's when you have a blood clot in your leg and the blood clot breaks off. Hey, Miss Pam. And it goes to your lungs. It can lodge there, and it can actually kill you. So you have to be mindful. Shortness of breath is a really, really, really scary one. Thank you guys for joining. Please put in the post where you're joining from. I want to see all the amazing states that we're reaching. So number 1, chest pain, because there could be heart attacks, there could be heart disease, there could be heart failure, that kind of thing. Shortness of breath, number 2, could be heart failure as well, could be heart attack, could be pneumonia, could be fluid building up on your lungs. So shortness of breath, chest pains, those are the obvious ones that you like. If I'm having a lot of this, I already know that I need to get to the ER. Number 3, if you faint. So a lot of people are like, oh my gosh, I just fainted and I was just down there for like 3 seconds and I just came to, and I waited a week to get my appointment in to see you. No ma'am. No, we don't do that. If you faint, if you're dizzy a lot, you need to go to the ER because what they need to do is to image your brain. You need to get a CT of your head to make sure that you're not having some kind of stroke-like symptoms. Fainting could also be your heart. If your heart is not in rhythm, fainting is just a generic, a big, large umbrella of things. So you need to be mindful that, hey, if somebody's falling out, they're falling out for a reason. If it's something other than they got too hot and you know that they were feeling fine,
Sorry.
Girl, go sit down. If they got too hot and you saw them, actually say, they fainted because they got too hot. But otherwise, if they're, usually overly healthy, or if they're on medications, they could be on too much of a dose. That could cause them to have some fainting. So fainting is a big deal. So 1, chest pain. 2, shortness of breath. 3, fainting. Hey, Miss Diane. Hey, Angela.
Hey, Miss Sandra.
We have a guest tonight on the Dr. Kre and Me show. It is Zoe Grace. She promised that she was going to come down here and sit down and hush. But she didn't. She is running her mouth. And she's very happy to be a guest tonight. Her dad is still at work, so she is hanging out and she's smiling so hard. She's very proud of herself right now. Just sit down. Okay, so number 1, chest pain. Number 2, shortness of breath. Number 3, fainting. Number 4, confusion. Okay, so let's talk about confusion. Confusion could be a sign of a stroke. It could actually be a sign of, if you're older, it actually could be a sign of some urinary tract infection. Anytime somebody calls and says, hey, I got this patient, they are just actually altered or just not themselves, then I'm like, okay, can they come in and leave a urine? No, they can't leave a urine. They wear diapers. We need to get them to the ER because an elderly person, if they have a urinary tract infection, it can cause them to have infection in their bloodstream. They can get very sick and they actually can die. So confusion could be the sign of a stroke. It could be the sign of a pulmonary embolism. It could be a sign of a urinary tract infection. It could just be a sign of infection in general if you are sick. Hey, Sandy. Thank you for joining us, the Dr. Kre and Me show. So sorry for all the noise in the background. We have a guest by the name of Zoe Johnson tonight. All right, number 5, you can have severe abdominal pain. Okay, so severe abdominal pain. Let's be clear. Now, if you're constipated, constipation can actually make you your stomach hurt. Like people don't realize it, but it actually can make your stomach just kind of ache or whatever. So I'm like, give me some details. Hey, Miss Deborah, we kind of halfway through. Zoe's been in and out, so you fine. Sandy, write in the post where you are viewing from when you get here. Hey, Tasha.
Hey, Tasha.
So I said, hey, number 5, severe abdominal pain. So severe abdominal pain could be several things. If it's located right up here, I don't know, you see my shirt though. This is so true today. My battery's empty. So if it's right on this right side up top, that could be your gallbladder. If it's down below on the right, that could be your appendix. So, and if it's over here on your left up top, it could be an ulcer that has perforated. Hey, Tashima. So you have to be mindful that there are important landmarks in there. Now, if it's a diffusely achy and severe, then know that, oh my goodness, it could very well be just gas, could be constipation. The first thing I want to know is, when did you poop last? Tell me, when did you poop? Was it normal? Was it pellets? What was it? What was it? Was it normal? Was it pellets? However, I just want to know. If it wasn't something that was your normal, then we need to start saying, let's make sure you get cleaned out before we go do $1 million workup. I did this huge workup on this lady, CT, X-ray, small bowel, swallow through, all of these things, and she ended up being full of poop. So make sure we're cleaned out first. Alginette, what did you say? You said on the left lower side. No, left lower side could be diverticulitis. The diverticulosis is when you just have, if you get your colonoscopy and you just have those little opening or out pouches in your colon. If they get inflamed, they get irritated, then you can have what's called diverticulitis. They hurt, you can have blood in your stool and fever. Right lower quadrant is your appendix. Right upper is your gallbladder. Left upper is your stomach. Hey, Alicia. So, number 1, we said chest pain or upper abdominal pain. Number 2, shortness of breath. Number 3, fainting. Number 4, confusion. Number 5, severe abdominal pain. Number 6, remember last week we talked about stroke-like symptoms, facial droop, slurring of the speech, weakness on one side. All of those symptoms, we not calling anybody to say, I think she had a stroke, do we need to make an appointment? We call the ambulance and say, hey, let's get to the ER as soon as we can. So, okay, does it cause gas? What is it? What is it? Diverticulosis shouldn't cause you any gas, if that's what you're talking about, left, lower. Shouldn't cause you any gas. It's just there. And depending on some things that you eat, depending on your diet, some things can irritate it and cause your gut to be inflamed, but it doesn't cause gas. So, number 6, we said stroke-like symptoms, and number 7, a fever. But the fever needs to be greater than 103 or lasting more than 3 days. So, if you have a fever, you're taking medications, and you don't fall. You have a fever, you're taking medications, and you are just, every time you stop taking medicine, it goes back up. You stop taking medicine, it goes back up. Then you have to be mindful that, let me try a little while, maybe miss a dose of medicine. Let's see how high this temperature.
Mommy, what's that sound?
Zoe, do you see I'm talking? I'm sorry. So, number 7, fever greater than 103 or lasting for 72 hours or more. So, if you have a fever, you're like, oh my gosh, I got a fever of 100.5 or 101.2. Those aren't things that necessarily should draw you into the ER. What's the best to take for a good clean out? Probiotics are good, and if you have to, every now and then you can take Miralax, milk of magnesia, mag citrate is good too as well. But I wouldn't recommend taking those on a regular basis. The probiotic you actually can take every single day. So let's review those, but don't get off the call because I want to talk a little bit while I have you on flu symptoms versus cold symptoms. So let's run these 7 again. Number 1, chest pain or upper abdominal pain. Number 2, shortness of breath. Number 3, fainting. Number 4, confusion. Number 5, severe abdominal pain. We talked about those quadrants. Hey, Dr. Mia. Number 6, stroke-like symptoms. Number 7, fevers, which is usually greater than 103 or less than 72 hours. So let's talk about now as a bonus what the difference is between flu-like symptoms and just a cold. So that's a big difference. So cold symptoms can be sneezing, congestion, I got a sore throat, I'm coughing, got some drainage, and you may have a little mild aches and pains, but you're able to get on and do what you got to do, and you're okay. So the treatment of that is going to be more so resting and hydrating and taking some over-the-counter medicines. If you have high blood pressure, do not take anything that has a decongestant in it, because D means don't. The decongestant can make your blood pressure shoot up. Miss Deborah says, Zoe, do you see I'm talking right? Hey, Miss Kim. What is it? What's wrong?
I'm trying to you keep moving.
I'm moving because I'm doing a class. Excuse me. So anyway, I'm back. So colds, sneezing, congestion, sore throat, coughing, drainage down the back of your throat, and just mild achiness. Something that colds can last up to 7 to 10 days. So this isn't a thing that you show up to your doctor and you're like, oh my gosh, I've been feeling bad for 3 days. It hadn't gone away. I need an antibiotic. So a lot of what we're seeing is that people go in and say, oh, I just need an antibiotic to get over it. I just need an antibiotic to get over it. I really need this antibiotic. So you're like, but after your body gets reintroduced to the same antibiotic over and over and over again, your body begins to recognize the antibiotic and says, I've seen it before. I'm not going to let it fight off what it needs to fight off. And if you have a cold, it's a virus. Thank you, Ms. Deborah. A cold is caused by a virus, and antibiotics will not work on a cold. So if you think you have what's called a common cold, which lives in your body all of the time, hey, Miss Kelly. So the common cold lives in your body all the time. It's just dormant. Sometimes it wakes up, goes back to sleep. Wakes up, goes back to sleep. Wakes up, goes back to sleep. But an antibiotic will not help the cold. You just gotta let it take its course, do its own thing. Antibiotics, yes. Antibiotics do not cure everything. So let's talk about the flu. The flu has been crazy this year because there are a lot of people that have actually, yes, they got the flu shot, but the flu, if you get the flu shot, and we get what's called the quadrivalent, or there's 4 most common, harshest, deadliest type of flus that's included in the vaccine. So you get a little bit into you, and then your body mounts an attack just as if you got the flu. So you get a little bit of the shot, you may feel a little bad, but your body that is not giving you the flu. You're not getting sick because, oh my gosh, I got this flu shot. It always makes me sick. So your body, the flu vaccine is as good as your body allows it to be. So you get the shot and your body mounts a great reaction to it. So you respond really, really well. Or your body doesn't mount a great reaction to it. That's why if you're sick, you have cold symptoms, you have a fever, we're going to say don't get the flu because we want your body to be as robust as it can so that it can really respond to the flu. So what is killing these people? So some flu symptoms are fever, maybe or maybe not. Just because you have the flu does not necessarily mean that you're going to have a temperature. You could have a temperature, you could have nausea, you could have vomiting, you could have diarrhea, even though those are more likely symptoms in children. But as an adult, you can have it as well. So you have fever, maybe, maybe not. Nausea and diarrhea, maybe, maybe not. Congestion as well, sore throat as well, but you're going to have some body aches out of this world. I have had the flu one time while I was in residency, and I was like, I would never skip over getting the flu shot again. I was cold for no reason. I had fevers. I had body aches. I could not move from the couch. I stayed in one place with a sweater on, looked like for 2 days straight until I finally began to feel better. You can hydrate. But here's the key. If you have the flu, you need to know within 48 hours because you need to have your symptoms and your test within 48 hours so that you can get the medicine called Tamiflu. So Tamiflu is an antiviral that helps to lessen the flu-like symptoms. You get Tamiflu within 48 hours, and it kind of quickens your time, with the flu. Is it true the test for the flu shot is only 60% accurate? Yes, false negatives are common. False positives, hardly are there false positives. However, usually that's why we draw more blood to go along with it. So if you come in, you get sick, you're like, man, I think I got the flu. Well, I'm gonna take into account all your symptoms, and 9 times out of 10, I'm gonna check you for the flu, but I'm also draw your blood. So I can, as a professional, I can look and say, well, this represents viruses, and that number is astronomical or whatever. So she's a good chance you got the flu shot. Flu illness, and then we'll say, hey, let's get Tamiflu if you're in that window. If you're past 48 hours, getting the Tamiflu medication is not going to be helpful at all. Let's see. Is the flu shot good to get? Yeah. Hey, Marcellus. Yes, it is. It actually is good to get. That's what I'm hitting on now. Getting a flu shot means that if you come into contact with the actual flu, then if you come into contact with the actual flu, then you have a milder case of it because your body's already seen that before. It's like, I recognize that to be the flu virus. Let's start fighting real fast so that you won't be able to have the symptoms as bad as you would have had the body looking at it like, there's something foreign in here, and it's trying to figure out how to fight this thing. we're trying to see what illness is that. But since you've had the vaccine, you've gotten a little bit of it in you, and your body's aware. Hey, we've seen this before. We know how to fight. We know how to fight fast. We know how to fight hard. Hey, Dr. Sam. So I wanted to tell you what cold symptoms were, what flu symptoms were, and what is actually killing these people, right? So a lot of times people end up getting the flu related illnesses are usually associated with having pneumonia. On top of it, they can get swelling of the brain, which is called encephalitis. That's something that actually kills people, and you'd be surprised that it attacks older people, and it attacks people less than 5 years old greatly. But some young healthy people can get it, and flu A will knock them down very, very fast. So big things that you can do to try and prevent getting the flu is, of course, washing your hands. Why not take Tamiflu prior to getting the flu? There's only so much Tamiflu out there. So a lot of years, people actually run out of Tamiflu. So, or they could get a shortage. So they want to make sure they have enough Tamiflu for everyone that has the actual flu. So if you have someone in your house that's living with you that's gotten the flu as well, like, okay, we got a flu positive in the house, so we definitely need you to be on Tamiflu. But if you think you've been around somebody at church and she looked like she had the flu, there will be a different number of days of the medication. So it's not made in that much excess where everybody can just start on Tamiflu, if you know what I mean. And then once again, you want your body to be able to, hey Keisha, hey Derek, hey Alvina. We got a guest tonight. Zoe Johnson is making her debut in Dr. Kre and Me tonight, and she is turning it all the way up. Okay, so just FYI, you need to know that you are not gonna just be getting antibiotics for no reason, just like we don't want to get Tamiflu for no reason. I moved the time up. To 6:30. I posted earlier that I'm going to start doing it at 6:30 to 7 instead of 7. So that's why. I'm sorry you missed the post. But to recap, what you missed was stabbing signs and symptoms that mean, hey, you should probably go to the ER and not necessarily just call your primary care doctor. It's been crazy, and we've been getting a lot of calls like, well, I need you to see them. It's like, well, we can't see them. And if you have the flu, a positive flu test, do not go up in everybody's office passing the flu around. Cancel your dentist appointment. Don't go to work. Cancel your primary care doctor, because you got to remember the flu is airborne. So you coughing, we don't want that spread to everybody. You don't want to that's not the gift that we want to keep on giving, especially with it being as horrible as it is this year. So the signs that you're seeing to the ER and not to your primary care doctor. Number 1, chest pain or upper abdominal pain. Number 2, shortness of breath. Number 3, fainting. Number 4, confusion. Number 5, severe abdominal pain. Right upper could be gallbladder. Right lower could be appendix. Left lower could be diverticulitis. Upper is the stomach. You could be cancel your appointment with your therapist as well. Left upper quadrant could be an ulcer. So number 6 could be stroke-like symptoms. Number 7, if you have a fever greater than 103 or a fever that lasts more than 3 days. So remember that the flu symptoms, or the liver over here on the right upper side. So the flu symptoms are much different than a cold. If you can, try and get the flu test so you can have it documented, either flu A or flu B. Get treated within 48 hours, the Tamiflu. Let everybody around you know that you got the flu so that they not just coming around. We want to keep everybody healthy. And what's killing people out there is that the flu can cause swelling on the brain, which is encephalitis, and it can also cause your immune system is low. So now you're prone to get all these other infections. You can get infection of the blood, and you can get pneumonia. So those are the things that should actually send you to the ER. Hey Lisa. So make sure to share this. Make sure to share this one, even though it's been very animated because we've had Zoe around. So share, so people will know. So when they call their primary care doctor, we're like, no, just go to the ER. No, go to the ER. You're not like, they just don't want to work today. That's not the case, because we have in our mindset a protocol to keep everybody else there healthy. So it may say, hey, you think you got the flu? Let me just call you in some Tamiflu. Hey, let me just do this, because we want to keep you at home, let you rest, let you hydrate, let you get well, but we don't want to put everybody else in jeopardy, especially if you have a low immune system. So, yes, encephalitis or swelling on the brain is definitely possible. So just be on the mindset. Look out for people. It's going to be very, very cold tonight here in Birmingham. By now, you've heard my announcement that I am now officially an author. And I wrote my first book. The 10 Commandments of the Working Wife. As you can see, we have this beautiful jewel here tonight with us, Zoe. So please go get your copy of our book, 10 Commandments of the Working Wife. Don't put that over my mouth. The website is thank you, sweet girl, workingwifebook.com. I'll put the link there, and it's a jewel. It's a lot of things that I just like to share with working wives and let them know that balance is actually available. You have to choose how to balance, but it's there. So I say no a lot. I cut off early. I only work 4 days a week. I try to take much better care of myself because I wasn't really balanced early in all of this.
Excuse me, Mommy.
Yes, baby.
I'm taking it off.
Oh, you're going to take it off. Okay, here. Oh, don't kick it. So, we're going to have a great night tonight. And if you have not bought your book, even if you're not married, buy a book for a working wife that needs some balance. This time don't work for you, for you kids. Okay, we'll see how it goes. We may go back to 7. But we had a bunch more people along tonight because of the new time. So, Deuce is talking to you, Zoe. Tell Deuce hi.
Hi, Deuce.
So tell them to follow Mommy where?
At Dr. Kre.
At Dr. Kre. You can follow me everywhere at Dr. Kre on all social media platforms. You know who I am. I'm Dr. Kre. I'm Zoe's mama and Jay's wife. I am their #1 fans. I am also a board certified. I'm going to put the link in there. It's workingwifebook.com. I'm Dr. Kre. I'm a board certified family medicine physician, and I wear a whole bunch of hats. But for now, I am helping you to learn to live healthier, happier lives, well balanced, nurtured, know what questions to ask your doctor.
Excuse me, Mommy. It look like you're...
At least you got manners. Okay?
Excuse me, Mommy.
All right, y'all. We're going to run, and I will see you next Monday. Time dependent. We'll think about that. To buy the book, go to, www.workingwifebook.com. Buy your book. It's $14 plus tax, so it's $19.99. Get your copy of my autograph book. I will see you next Monday, and looks like Brownstone going to be closed tomorrow. But official details to follow. Have a good night.